The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, welcome to Aging Horizons. On today we'll be talking about Medicare. There's some new things on the horizons that's happening with it. We want you to know about that. But we're going to talk about what Medicare is, who's eligible, when you're eligible to get it, and we'll be talking about a number of programs that are available if you are eligible and with people that can help you with that. So stay tuned, we'll be right back.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Someone who said they were from Medicare called and asked for my personal information.
I noticed a charge on my Medicare statement for a test I don't remember having.
I got a letter offering me free medical equipment if I gave them my Medicare number.
Something didn't seem right.
It seemed too good to be true.
If something seems odd, it's probably fraud. Call Senior Medicare Patrol at 800-551-3191 to report fraud. This project is supported by a grant by the Administration for Community Living.
Here in Montana, we love our outdoor activities. Unfortunately, few of them are risk-free. Indeed, Montana is second in the nation per capita in head injuries that can destroy the lives of people we love. That's why you should insist your family always wear protective helmets. But you can do even more. When you fill out your vehicle registration this year, circle the Y and donate $1 to support traumatic brain injury prevention and education. Now that's using the old noggin.
Today, class, we'll be discussing the term ombudsman, a word we borrowed from the Swedes and never gave back. Say you're a resident or you have a loved one in long-term care. Now, what do you do if you're not happy with the care and services you receive? You call your long-term care ombudsman, of course. Your ombudsman is available to support you and your rights. An advocate on your behalf could be the ticket. This is your home. If you have questions, the numbers right there below me have all the answers. Class dismissed.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services, Senior and Long-Term Care Division, Aging Services. And I'm your host, Brian Lamore. We're talking about Medicare today. There's been some changes or things going on with it during the year that you'll be interested in hearing about. But we will start with some simple things at first. What is Medicare? Rejoining us is Janet Stillman. You're the Medicare person with Aging Services. Welcome back to your show.
Thank you.
Now let's start at the top. When does an individual become eligible for Medicare?
Most people become eligible for Medicare when they turn 65. There's some people that are eligible sooner if they've been determined disabled by Social Security and they've served like 24 months. And they can become eligible for Medicare too. Also, people with end-stage renal can get a fast track into Medicare, as well as people with Lou Gehrig's disease, ALS.
So, and basically you need to have been working for a certain period of time to become eligible for Medicare, right?
Right, usually it's 40 hours, or 40 work credits, or 10 equals 10 years of service. So you earn 4 credits a year, and so if you've earned that, those 40 credits when you become eligible for Medicare, you should have premium-free Part A. That is your hospital coverage. You still have to pay for Part B and the rest of it. But
yeah. And then let's start with what Medicare is. There's ABCD. We call it the ABCDs of Medicare. Tell us what they are and maybe how we're eligible, maybe what they cost.
Right. So there are several parts of Medicare and several different ways you can do it. So Medicare is a federal program for to help people with their medical costs. So there are several different parts. We're going to talk about the traditional part first, and that is you pick up a Medicare Part A, which is usually for most of us is premium free because we've worked the 40 credits or 10 years in service, so we get premium free. If you didn't have that much service or for equal to the 10 years, you could pay up to $500 a month for $550 a month for your Part A. Yeah. But like I said, most of us have premium free Part A. Then there's Part A covers your hospital stays. So every time you go to the hospital, in the hospital. Yeah. Then there's Part B, which is your doctor services, and so that is this year it's $202.90 per month. Okay, and so those are your two main parts, and then you can pick up what's called a Part D or a drug benefit, the prescription drug benefit, to cover your prescription costs. So those are the three main parts of Original Medicare. With Original Medicare, you're going to be paying 80-20 split. So Medicare is going to pay 80, you're going to pay 20% after deductibles and coinsurance. But over here, you can also pick up what's called a Medicare supplement or a Medigap. Those are private insurance companies that they help cover that 20% gap, help pay that 20% gap. So those are independent or just private insurance companies that offer those plans, and you can get like the really basic all the way up to a really gung-ho plan, but you're going to pay,
Yeah, it's cost with them.
Yep. So the other way to get your Medicare is through Medicare Advantage or Medicare health plans. So Medicare gives pots of money to Humana, United Healthcare, Blue Cross Blue Shield, like that, yep. Those type of companies. And Medicare, or those companies administer the Medicare benefits. So you still have Part A and you still have Part B and you still have to pay for Part B premium. And usually there's Part C or D connected. And so a drug benefit. So those Medicare Advantage plans has to cover everything that traditional Medicare covers, but it can cover sometimes extra stuff. So it may include dental, some cleaning, some oral exams, some periodontics, whatever. It could include vision, like maybe you can get a screening or, go to the eye doctor, maybe get a pair of glasses, and also hearing, so help with your hearing aids if you needed that. It also covers everything, like maybe some exercise classes, which might lead into maybe a membership at a club, and just maybe some over-the-counter type health benefits that you may be eligible for too. The other thing about Medicare, the difference there when you're looking at Original Medicare, you're paying 80-20 all year long. With a Medicare Advantage plan, they have maximum out-of-pockets. So if you go, and one thing I should mention about Medicare Advantage plans is most of them are really reliant on networks and preferred providers. So if you go to those in-network doctors, providers, then you're going to get the best prices. So they have what's called maximum out-of-pocket, so that's the maximum you'll pay every year with your in and out of network costs that you've incurred. So that they could be as low as, like, I think one's $4,500 and then with in and out of network type stuff, like $12,000. So you hit that, the company's going to pay the rest, should be paying the rest of your bills for the year. So those are the two ways you can get Medicare. You can't have a Medicare supplement over here if you have a Medicare Advantage plan, and it's legal for them to sell that to somebody like that. And Medicare Advantages work great for some people, and they don't work real great for other people. So, and it really depends on those networks. If you live in rural Montana, you really need to look and see what providers are available and how far you have to travel to see those providers. So,
and Janet, you're making this sound a little bit complicated. I want to say really quickly, we have Medicare counselors throughout the state that are there to help you. And if you call the 800 number that we'll have on the screen a number of times, they'll help you over the phone, or they'll help you in person, or they do presentations in your communities. Now, we've drawn to a close pretty quickly in this first segment. We're going to talk to you about new things that are happening this year with Medicare, so stay tuned.
A message from FireSafe Montana. While a prescribed fire can put smoke in the air for several days, a wildfire can rage for weeks or more. Restoring fire to an ecosystem can be essential to maintaining desired range and forest habitat. Proper use of fire can minimize both short and long-term fire risk to nearby populations and property. For more information, contact FireSafe Montana today. This message brought to you in part by Northwestern Energy and aired by the Montana Broadcasters Association.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Montana's veterans answered the call. Now our veteran service officers are here to answer theirs. Whether it's filing a claim, accessing healthcare, or navigating earned benefits, you're not alone. Our VSOs provide expert guidance at absolutely no cost to you. You served our nation. Let us serve you. Visit your local VSO today. Call 406-324-3742 or visit veterans.mt.gov. Montana serving veterans.
Hey caregivers, did you know that respite time is your time? How will you spend it?
When the weather's good, I gotta get away for some fishing, and that's a must.
Fred Dahlbeck. Clancy.
My grandson tells me we suck at golf. Fun though. And there's never enough time to keep the old 57 Chevy happy.
Montana Lifespan Respite. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Come on, girl.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicare in Montana, and how some of our SHIP counselors can help you. But some new things have happened this year with Medicare, and here to talk about that is Janet Stillman. She's the SHIP director for the state of Montana. And Janet, as I understand it, weight loss might be eligible for Medicare reimbursement now.
Right. So beginning July 1st, it's a demonstration program, and it goes from July 1st until December 31st, 2027. Okay. So eligible folks, they need to talk to their doctor about it and make sure their doctor's, on board with it. They have to have a Part D, a drug benefit plan. They have to talk to their doctor about it, and their doctor can get it can possibly get it authorized for people that, I think it's like there's different requirements, like your BMI, your body mass index needs to be over 35, or it needs to be this amount with these kind of conditions, like you've had a heart attack or whatever. So just talk to your doctor about it, and the doctor can get authorization, and it could possibly cover like Wegovy and Zepbound, which are two of the weight loss injectables that are available. And I think there's another one on there. I wasn't familiar with that one. But if you get approved, then you would have a $50 a month copayment for those shots. And as we know, those are very expensive shots. So a $50 copayment, and and so that could be really helpful to some people. If somebody is already on, if somebody has diabetes, or they have a reason to get that because of their diabetes, then that would still go through their Part D plan, and it would, the cost would be co-payment. So it's actually going to be cheaper for those people usually that are on, that have the diabetes or the pre-diabetes, and they're already on them, to get it through their Part D. This plan, or this demonstration program, yes, you have to have Part D, but it's not coming out of your drug plan. It's not coming from your drug plan. It doesn't cost, or it doesn't calculate towards your total out of pocket for the year, the $2,100. So it's an extra $50 a month to get that. So. And so that's just started July 1st, and it goes through December of 2027. So.
You know, and it sounds like you mentioned there's a number of conditions there, and our viewers, don't worry about it. Your doctor will help you and tell you if you're eligible and the advantages of it, which is really important. But now, as I understand, there's been a data breach with Medicare. Tell us what that is and how does that affect our viewers?
Yeah, that was there was a data breach early. I don't know exactly when it was, but I know that in March, people that were affected by that data breach started getting Medicare cards, new Medicare cards, because when Medicare took this Social Security, you know, disconnected it from your Social Security number, they went to that, you know, kind of weird numbers. Well, if your Medicare number gets compromised now, they can just issue another Medicare card, different number. And so people started seeing that in March. I know my mother-in-law got one, and it was because her information was part of that data breach. Okay. And so she got a new Medicare card number, and so we had to make sure to update that with her providers. There were some, you know, of course the bad actors start popping up because of that. So people were getting calls about, this is Medicare, and you got a new Medicare. We're just calling to confirm that you got your Medicare card, and can you tell us what your number is just to confirm that you got the right number? Well, that's not Medicare calling. That is not Medicare calling. That is somebody wanting to get your Medicare number so that they can commit fraud somehow. So again, like we had our SMP on a couple of weeks ago, you know, don't give your Medicare information out. Don't give your Social Security number. You know, if you don't know for sure who you're talking to, hang up. Medicare's never going to call and ask you for that information. Social Security's not going to call and ask for that information. And they're definitely not going to ask you for your numbers because they already know them.
Yes, exactly.
Just be really careful because identity theft is tough. So.
Oh, and it's rampant. That seems to be the number one scam. Let's take your identity. But now, Medicaid has a ACA change. What's the ACA? What's Medicaid? And what's the change?
Okay, so we're kind of switching gears here just for a minute to Medicaid. Because our SHIP counselors help people with Medicaid, help them apply, help them get an application in, help explain some things to them. I just wanted to bring this up. So Medicaid, that is the state program that helps, well, it's federal, but it's administered by the state, and it provides Medicaid to low-income folks. So the ACA is the Affordable Care Act, or Obamacare, which we knew it as. And during, when that first came to, it gave Medicaid eligibility to certain folks between the ages of 19 and 64 that didn't qualify for other kind of Medicaid. Okay, so because of the, I think it's HR1 or the big beautiful bill, they put stipulations on folks that are getting that Medicaid that they have to do 80 hours per month of work activities or volunteer activities or whatever. I mean, there's some exceptions to that. There's definitely exceptions, you know, if you're unable to work or if you know, you'd have to call your Medicaid person. But if you're in that age category and you're on that type of Medicaid, you know it's expanded Medicaid or the ACA or Affordable Care Act or Obamacare. Just be really paying attention for your notices and reading your mail and make sure that, you know, if you need to do that, you need to know that what you need to do to meet the requirements. So, or else you're going to lose your Medicaid. So it's very important to be looking at your mail and talking with your the Medicaid office about what's expected of you and how you need to document that. And that started July 1st, so we're 2 days into it.
That's in order to keep your Medicaid insurance. Now we've drawn to a close on our second segment. Next segment, we'll talk about some helping programs, helping to pay your Medicare premiums, so stay tuned.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
Hey, caregivers, did you know that respite time is your time? How will you spend it?
Respite is really perfect for things I like to do, but my son isn't interested in.
Vicki Henry, Manhattan.
Gardening isn't one of his favorite things, and he knows and likes his caregivers a lot, so it's a win-win. Or even something as simple as a bike ride becomes possible when I know that someone I trust is with him.
Montana Lifespan Respite. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
It's good for both of us.
I was diagnosed with diabetes in 1992 and I went into denial. It made me angry. I was a professional chef and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we're continuing our discussion about Medicare. Now, the next segment, this last one, we're going to be talking about certain programs that are out there that you may be eligible for. They all have different eligibility standards, and your SHIP counselor can help you out with those if you need a little assistance. Rejoining us is Janice Stillman. You're the SHIP director for the state of Montana. Helping programs. Great title. What are they?
First off, I want to shout out to the helping people, the SHIP counselors that are available to help you sign up for these programs. So we know that Medicare is a great program, but it has some costs, to it. And some people have a little trouble meeting those costs. So the first program I like to talk about is the low income subsidy or the extra help. It is a program through Social Security to help you pay for your Part D drugs, your prescription drug plan drugs. So it also can pay your premium up to so much. So, and then it gives you co-payments of anywhere from $1 to $12, with a maximum up to $2,100. Which, with $1 to $12 co-payments, as long as your drugs are on your formulary, you're probably never going to get to that $2,100 because your co-payments are low compared to $50, $60, $70 per co-payment, which some people pay. So that's a really great program. You apply for it on, you can come to a SHIP counselor and they can help you apply for that. It takes less than 10 minutes. It's a really quick application. You can also go to the socialsecurity.gov website and apply for the extra help for your Medicare. So that's the first program. The second program is the Medicare Savings Program. I love to talk about these. I say that all the time. Medicare Savings Programs, even though they say Medicare, they're administered through the Medicaid office here in the state. So that's where you apply, is with the Medicare or the Medicaid office, sorry. So there's 3 levels of that: QMB, QMB, Qualified Medicare Beneficiary; SLMB, SLMB, or Special Low Income Medicare Beneficiary; and QI, which is Qualified Individual. So QMB, being the Cadillac model, it helps pay that if you were one of those people that didn't have enough work credits to get premium-free Part A, it will pay your Part A premium. So remember, I said that was like $550.
Yes.
So that's really good. It also pays your Part B premium, so that $202.90 a month. And then it also acts as like a supplement to your Medicare. So remember, I said Medicare pays 80% and the beneficiary pays 20% with their deductibles and co-payments. Well, QMB comes in there and pays that 20%, or any of those co-insurances they might have with a Medicare Advantage plan. So basically, there should really be no real expenditures for the person after, for their medical side of it. So that QMB is for the lowest income people. It's like, I don't even want to say, it's like $1,000, $1,200 a month gross that somebody can make. And it also has some resource guidelines too. The next program is SLMB, Special Low Income Medicare Beneficiary, and it just pays that Medicare B premium, so that $202.90 a month. And then there is qualifying individual, and that too pays the Medicare B, only the Medicare B premium per month. it has a little bit higher incomes. Each of them, Quimby has a little bit higher income than, or Slimby has a little bit higher income than Quimby has, and then Qualified Individual has a little bit higher income yet. And the difference between Quimby and QI is that with QI, Qualified Individual, you can't be on another Medicaid program. So if you are on Medicaid, you have to decide, do you need the Medicaid and possibly having to pay a spend down to get your Medicaid, or would the $202.90 in your pocket be more beneficial? So you'll have to decide. They can overlap for 1 month, but then that's it. And it must be, I think it has something to do with the funding and where the funds come from, is why you can't double dip on them, having that program and Medicaid. So those are great programs. Some of them can be backdated 3 months from the application. Slimby and QI, if you went in and applied today in July and you were determined eligible in June, May, and April, you could get reimbursed those $202.90 for April, May, and June.
Yes.
Plus get, starting in July. So,
that's great.
It doesn't come automatically. It takes a few weeks to get started, maybe a few months, but it'll start showing up on your check again. And for those three backdated months, you'll get a reimbursement check on that too, and it'll be a couple months, maybe up to a couple months. So
okay. Now, Janet, this sounds a little bit complicated for some people, particularly if you're elderly and maybe you have an illness. But we have people that will help you out. They're SHIP counselors throughout the state. Tell us more about these wonderful people.
Yep. They are great. They're located most of them are located in the area agencies on aging. There are some in community health centers, some at the major hospitals. You'll find SHIP counselors. You can call the 800 number on the screen and it should route you to your current SHIP counselor. So there are SHIP counselors in all of our 9 area agencies on aging, and they cover every county in Montana. They may not live in your county, but they cover it. So they are free, confidential, unbiased. We get paid by the federal government to help you. We don't get paid from insurance companies. We don't make commission, anything like that. And we will not recommend a plan for you or tell you what plan to take or tell you what to do, but we'll explain it and empower you to make the best decision about your healthcare needs. One thing I forgot to talk about real quick is the Big Sky RX program. It's another helping program to help pay your Part D premium. So I think it's up to 41 something per month, they could possibly pay your Medicare, your drug benefit premium. So we can help with that too. So
that's great. Well, we've drawn to a close so quickly, Janet, and thank you so much for being on the show and coordinating all these shows. And for our viewers, I think we've kind of went over a lot of different issues here. We're on YouTube if you want to catch a back show that we've had, or contact your SHIP counselor that's in your local community. They know all this stuff. They're there to help you, so you don't have to figure it out yourself. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.